Great. Thank you. I'm curious to know, after this conversation, how many of your sermons on or talks this weekend will include rising above the pepper grinder as a theme. So congratulations on continuing your train of thought while that grinder was doing the rounds. It's often difficult to talk with that kind of distraction. So just a little bit by way of background. You may have noticed, just as a couple ground rules, there is a camera here. And yeah, so the purpose of which is twofold. Part of this listening tour that we're embarking on, requires us to, when we get together, to sort of listen attentively, pay attention, not sort of sit here and be taking notes while you're talking. So it allows us to sort of engage fully and share with other people who aren't in the room today. The second is that, as Steve alluded to, we're talking to a lot of different people in the community. People in the faith-based community are very important, as were first responders, people in the nonprofit sector, people inside of Cottage Health, outside of Cottage Health. We had a group yesterday on educators. And part of what we want to do is, when we're done with all of this, not to just sort of go back to you and go back to the community and say, here's what we thought, but to say, here's what we heard, and to have your voices represented in some of the things that we may share. So in some cases we're videotaping things, in other groups we're doing audio recordings. So you'll see a waiver in front of you. If hopefully you feel comfortable signing it, we will be sharing what we produce with those people who are in it beforehand. If there's anything during the course of the conversation that you would prefer us not to include, certainly point it out and we'll make sure we respect your wishes. We are here to mostly listen, so I'll sort of ask you sort of questions that'll allow me to take a couple bites of food, and I'll try to not to call on anyone who's in the middle of a chew, so I'll try to respect that. By way of background in terms of population health and sort of why we're working on this, it's the idea that we recognize that so much of our health happens outside the walls of a hospital or a doctor's office. It's impacted by where we live, where we learn, work, play, where we worship. So if we're truly trying to make a difference on the health of different populations, whether it's our elderly, our homeless, our young people, it's good to understand how they go about their lives and the challenges they face and the barriers to addressing that. So individually, when we think about health, sometimes we think about at the patient level. And population health sort of takes a step back and says, what are the common issues that certain groups are dealing with? And how can we create interventions that can help those groups more efficiently and more quickly to achieve better health? So before getting started, are there any questions about today or what we're about to sort of jump into?
So this is beyond the experience in the hospital setting. This goes into the community.
Yeah. So one of the reasons why we thought this group was so important to sort of put together is that obviously you have very important and personal relationships with so many different types of members of the community. They share and trust you in a way that is probably very unique. So we encourage you to sort of be open without obviously sharing sort of personal details of individuals. But one of the things that is critical is to hear these stories about some of the challenges that people face in this community, because they provide sort of texture and insight into the lived experience of people that we're trying to help. So just by way of introduction, it would be helpful if we go around the table and just introduce yourself and share a little bit how long you've been in Santa Barbara, where you currently preside, and what the thought of when I say, what does a healthy community look like? What does that mean for you or for your congregation or parish? So we'll go around the room, and just for way of background, my name is Bob McKinnon, and I run an organization based in New York called Gail Will, where 100% of the work that we do is on social change. So we work with foundations and nonprofits and some government work on a whole host of issues. And we are working with Cottage Health to basically help in the formative stages of this population health program, and it starts by sort of listening, and that's what we're sort of doing now. So I will turn it over to you for your first introduction.